Okay guys, so in this video we're going to go through a soft tissue release technique for QL for lower back pain patients. So Glenn, how would we do that?
I think the first thing to bear in mind when you're doing this technique is to look at position, and that varies with person to person. So with Kate here, when we laid her flat, the QL muscle was in a shortened position, so we've popped the pillow underneath, and we can even ask Kate to bring her hand up over her head to create a little bit more of a stretch. And depending on irritability, you might want to do that. If they're very irritable, you might actually want to treat them in a shortened position where it's less tender. Yeah. From here, what I'd like to start with is a trigger point release, if you know it as that. But essentially what we're looking for are sore tender points within the muscle, which we're going to apply pressure to, and then from that pressure we're going to get a reaction that reduces the pain and reduces the sensitivity. Yeah. So if we take our hands and we come off the top of the iliac crest and we just trace and feel around there, you can perceive points of tenderness or tightness, but the main feedback I'm going to get is from the actual client themselves. Yes, I'm going to be asking, is that sore, is that painful? Yeah. When I find a painful point, I'm going to hold that pressure, keep it there, encourage the patient to take some nice deep breaths, and just maintain the pressure until the perceived pain comes down. Mm-hmm. And you can normally find 2 or 3 points around the top of the iliac crest and just under and close to the spine around the inferior to the 12th rib. Yeah, so that's how I would normally start off. From there, nice progression is to actually do some soft tissue massage, essentially deep tissue massage, and this again is the position that I like to do that in. And I'll place a little bit of oil, come off the top of the iliac crest, hold my pressure in, and just work round and across medial to the body. Yeah, so I think after about 5 or 10 minutes of this kind of technique, quite often the patient will feel that it's getting easier, that it's releasing, and it can set you up for some other really nice treatments like muscle energy techniques and active release that we'll go through in another video.
Yeah, and with the trigger point stuff, you're doing up with your thumbs mainly, whereas with the soft tissue, as you just said there, you're kind of, hypothenar eminence and just coming through.
Exactly. Yeah, I find that's most effective for keeping the same pressure as you go across, more comfortable for the patient as well. Trigger point treatments, it is an uncomfortable treatment to perform, so you want to be on the exact point with the thumb.
Yeah, perfect.